Hey, it's Sanjay Sharma here, editor-in-chief of NursingSKL, where we help nurses really upskill to the next level. This is a great case that I want to walk you through, but I also really want to, the reason I'm walking you through this is because this person was undiagnosed with this medical condition. And if you know what this is, I'm going to be so impressed. And it kind of highlights the fact that we're in a situation here in Canada where, unfortunately, there's so many people who don't have primary care physicians, which is tragic situation. So I'm going to go right to this. Hopefully, this is the fundus. So we're looking at the retina. We've taken a picture of the retina. And here what we are looking at is the optic nerve. The optic nerve looks pretty good, actually. So, nice sharp margins. But what is a little bit abnormal is you can see these very fine little blood vessels on the surface of the retina. A couple of other things as we start to look at, here's a vein and here's an artery. The way you can tell the difference between an artery and a vein is the vein's actually a little bit darker than the artery, and the artery is just a little bit thinner than the vein. And so here's the same thing. So here's the vein and here's the artery. We can see some scattered hemorrhages, really throughout. We call this the macula. The macula is the central portion of the retina here. Here's the macula. It's kind of that central, 5 or 6 millimeter area, but it's the area that's so important because it's responsible. It's really rich in cones. Remember, the cones are those little photoreceptors that are really super important for fine vision, for color vision. Second thing that we're noticing, few scattered little kind of whitish areas. These are called exudates. They're lipids and proteins that are seeping out of the blood vessels. And you can also really appreciate, look, this like kind of frond of tiny little fine blood vessels. So this is called neovascularization here. This is also neovascularization, new blood vessels. Now, neovascularization on the retina may sound like a good thing because we're getting more oxygen, but the problem is they're extremely fragile and they can bleed. And when these blood vessels bleed, they actually, and I'm going to draw over here, let's look at the eye like this, and here's the nerve, here's the cornea, and we're showing you, I'm going to go to red here, here's like that little frond of blood vessels right on the surface of the nerve, and there's another little frond here. The problem is when these bleed, they bleed right into the jelly of the eye. So when the light comes in, it bounces off of this blood and leaves a shadow on the eye. And our brains kind of interpret that as a kind of a cobweb or floaters. So any patient, I'm sort of giving this away, any patient who is a diabetic and they have new onset floaters has a vitreous hemorrhage related to new blood vessels until proven otherwise. Now, how do we get rid of these new blood vessels? What I actually do a lot of is I put a needle in the eye and inject an antibody, a monoclonal antibody called anti-VEGF, which is vascular endothelial growth factor molecules to help shrink those blood vessels down. Sometimes if we see fluid in the eye itself, we also use that medicine because it helps dry things out. Now, just side note, if you're wondering, hey, is this normal here? It's not. This is a little freckle. It's actually called what we call a choroidal nevus. Now, in the setting of diabetes, we do need to make sure that we're screening for diabetic retinopathy. Because remember, I know you're used to hearing, diabetes can cause problems, increased risk of heart attack and cause increased risk of stroke. And that's typically because it affects the larger blood vessels. But remember, diabetes can also be a microvascular disease. So I'm drawing a capillary in cross section here. And so in the retina, we have endothelial cells, and then we also have, or we call pericytes actually, which increase the kind of tonicity of the blood vessels. And so what happens here, and I've drawn sort of the basement membrane here, we have glucose depositing at the level of the basement membrane, and that causes thickening, and that causes destruction. And I won't draw any more endothelial cells here. And so if there's no endothelial cells, the blood pressure, the pressure can kind of push lipids and proteins and hemorrhage across basement membrane, and we have loss of the pericytes as well in through here. So that causes all of these little A, microaneurysms, and B, hemorrhaging. So that's a form of diabetic retinopathy. So there's two types of diabetic retinopathy. There's non-proliferative, where we have hemorrhages and fluid and death of the of some of those axons, we call those cotton wool spots, or proliferative retinopathy, which this patient has because we have new blood vessels growing on the surface of the retina and the disc. Now, so when do we start to screen? Well, type 1 diabetics, typically it takes a while for these changes to occur. So we typically see them at 5 years after the time of diagnosis. But type 2 diabetics, so the vast majority of people that we see now, they can have diabetic retinopathy at the time of diagnosis. So if you have a new onset diabetic patient, make sure that they're getting referred to an eye doctor for screening for diabetic retinopathy. These patients are also microvascular, can also affect the peripheral nerves, so they can have a neuropathy, and they can also start to have kidney disease with a nephropathy. So all three of those things, diabetic retinopathy, peripheral neuropathy, and nephropathy, diabetic nephropathy, are all small vessel changes. Now, remember, because again, I'm just sort of emphasizing, it's great, like anyone that we see who's a newly diagnosed diabetic, I will see them, no problem. But also remember that because these patients don't have doctors now, they're coming in presenting with new floaters and things like that. So if you have any patient, with new floaters or, kind of sudden onset blurred vision, you should refer them to an eye doctor for screening and detection and diagnosis for these particular problems. So if you want to learn a lot more about diabetes, hop on over to NursingSKL.com. You're going to get access to over 40 cases from award-winning healthcare practitioners. You're also going to get access to clinical tips and live sessions and games, and it goes on and on and on. So if you're committed to taking your skills to the next level, we're here to support that journey. Head over to NursingSKL.com. Hope you enjoy this clinical tip. Cheers.